I'm Dr. Gerald Chodak. Still another option for minimally invasive treatment of problems with the prostate is called TUNA, or Transurethral Needle Ablation. This device, or this treatment, uses radio frequency waves to heat up the prostate gland. If you get the prostate cells hot enough, the cells will die, and over the next few weeks they'll be reabsorbed and disappear and remove some of the obstruction. This treatment has been around for quite a number of years, and it is a reasonable option, although it does appear to be less effective than the standard or traditional TURP procedure. So what's good and bad about it? Well, it requires some anesthetic, usually that's given into the arm to make you sleepy, because there can be some heat generated that you may feel during the procedure. So after you've gotten your anesthesia, the patient is placed on a table, and with their legs up in stirrups, an instrument, a cystoscope, is inserted through the penis into the area of the prostate. A special designed catheter is then inserted through this instrument and pushed into different locations around the prostate gland. This needle is connected to the radiofrequency instrument, which generates heat over the next 1.5 to 3 minutes. The latest instrument you can do in just 1.5 minutes for each location that you place the needle. Generally, the number of needles is determined on the size or shape of the prostate. So oftentimes we do 4, 5, 6 on average. Larger prostates will need more treatment. The treatment is best served for men whose prostate is not too large. Generally, in the 20-gram range would be a reasonable option, but the larger the prostate, the less likely the results will be very effective. One of the problems, you may get some blood that goes into the urine after the procedure. That requires a catheter in order to help you urinate. Another thing is the heat can cause swelling, making it also difficult to urinate. So some men that have this procedure may need the catheter more than 1 or 2 days. Sometimes it could be there for 10 days to 14 days. So a disadvantage of this treatment is that the improvement rarely occurs overnight like it does with the TURP or with the green light laser procedure. So you have to be more patient to see the symptoms improve. You may need a catheter longer. On the other hand, you don't need to be hospitalized, and it can be done in the doctor's office. Another problem is not only does it not do as an effective a job at improving the symptoms, but the failure rate and need for additional therapy is higher compared to the standard TURP. So it does have advantages, it does have disadvantages. It's relatively easy to perform. And if it doesn't work, you can undergo one of the more extensive procedures at a later date. So it depends on your tolerance and desire to have as little done as possible, and your willingness to accept having to have the procedure performed at a later time if your symptoms either don't improve enough or if your symptoms recur. So it is another option to consider among the various options for managing your problem. Thank you.